You are listening to the Critical Mass Radio Show, Orange County's business talk show, focused on exploring topics of interest to CEOs who are leading middle market companies. With your host, Richard Franzi.
Hello and welcome to Orange County's longest running business talk show and podcast. And yes, I'm your host, Rick Franzi. And boy, do we have a good show planned for you. Why do you ask? Because we not only have the CEO, but we have a founder of our own company. And as you can see, if you're watching the live stream, it's Sandy Eulitt. Sandy, welcome to the program.
Thank you, Rick. It's great to be here.
Sandy is the founder and CEO of Life Backup Plan, and we're going to be talking about that app. So let's start there. Your kind of origin story in a way. What was the original inspiration and motivation that you had to begin to build and develop this app?
Well, if you looked at my medical records, you'd go, wow, you've had quite a number of procedures done there. And I was recovering from one of those a few years ago. And at the time lived very close to a really good friend of mine. But I wasn't being checked on, but like once every 2 or 3 days. And I lived in a 2-story home, and there was, kind of a wall at the base of the stairway. And I thought, I could take a really nice header down these steps and hit my head on this wall, and I could lay here for days and nobody would know. And there should be an app that checks on people. So I invented one because I have a background in IT and software engineering and all that stuff. And I was like, I know the technology exists for this, and I know that this can be done. And it really started just with this basic idea of being checked on, but then it went to, okay, so now I've been checked on. Okay, so now I have a problem. How do I get people into my home? Oh, well, I should put in my home access instructions. Okay, so now I've got people in my home. Now what are they going to want to know? Well, they're probably going to want to know my blood type and my medical history and who are my emergency contacts. And, if I'm dying, like, where's my DNR or my durable healthcare power of attorney? And it just went on from there. And that's really where it ended up. And it's ended up as a complete end-to-end, what I call an interoperable life care platform.
So I'm wondering, from the inspiration, motivation, and I love it when I have entrepreneurs such as you on the show, Sandy, who are building a business around a personal experience. I think that's very powerful, and there have been many over the years we've done that show. It sounds like either in your own mind or through developing the platform, you've had some pivots to the original business idea. And if that's the case, can you sort of diagnose those pivots for us a little bit here?
Definitely. This originally began as an app for, say, people home recovering from surgery or an illness, or seniors, or women. We have unique safety challenges, as you might be aware, or parents to check on their children. And there's a substantial market for those segments right there. And then actually in May of this year, our chief medical officer said to me, this would be a great app for hospitals to use for post-discharge monitoring. And I looked at her and I was like, you're a rocket scientist. I would have never thought of that. But then again, I'm not a doctor, so why would I have thought of that? And so, and then she suggested concierge medicine as well. And then kind of around that same time frame, it dawned on me that this is really a health insurance adjacent app. This is something that people should be using kind of in conjunction with their health insurance. And therefore, we should be marketing this to employers and to government agencies for their employees, and also to like FEMA as a safety app. So there's a huge pivot that happened around 6 months ago.
Mm-hmm. So my records suggest you've been on this journey for 3 years plus?
A little less than 3 years, yes.
Oh, okay, a little less than 3 years. So speak to, maybe you'll be speaking to what already other founders know, the evolution, the amount of energy, the effort that it takes to get from the idea through the pivots to what is now the current platform and development that you have going on?
Well, with my technical background, I kind of did things, what I've since learned is in the reverse order, which is, I was told when I hired a developer, oh, well, we need your user personas and then we develop all the screens and stuff from there. I'm like, yeah, we didn't do that. I just decided to build the whole database. And I mean, not just the database for what is currently released, but the whole database for every idea that I've ever had to pour into this thing. And then I whittled it down to, okay, we're going to start with this much. But because of that technical background, I was like, oh, I can develop this myself. And a friend of mine who's known me for a long time and has taken technical classes with me, he's like, you could totally develop this. And I started down that road about 2 years ago. And about 5 months later, I had 3 lines of code written. And I said, this thing's going to get done the second Tuesday after you die at the rate that you're going.
Right.
Perhaps you should hire a developer. So I did. Okay. And so as a founder, you have so many hats that you have to wear. And you just kind of have to look at it and say, okay, what are the things that I can't get rid of? Like taxes and corporate filings and, employee issues and things like that. And then decide, okay, what can I outsource? And development to me was something that I felt comfortable outsourcing, in part because I already had the background and I knew I could speak geek to my developer. I wouldn't necessarily recommend that for people who are non-technical founders, because we've been able to collaborate over things, and he's in Pakistan, so all of our meetings are via Zoom. But we've been able to collaborate, and he'll suggest something and I'm like, but wait, won't that mess up your ability to get this out of the database, in order? He goes, oh yeah, I hadn't thought of that. And so we can run through ideas in a technical manner. That's been very helpful, but it's been great having him, because I would have never gotten this done without him.
That's a hard thing, especially in the early days when you feel like if I do it, it's free. If I have somebody else do it, I have to pay them. So sometimes founders try to do as many of the things for free.
Time
as
is money.
possible. Yeah.
Time is money, and the market doesn't sit still.
So let's talk about the current iteration. Talk about the niche that you're addressing. I know you see sub niches, but kind of your philosophy on who would be interested and benefit from the app, and what the app is solving for them as from problems, and then ideally the type of person that would really leverage the power that's inherent in what you've built.
So, people talk to me about niches, and originally we did have a niche, and as this has evolved over the past several months, as I said, where I realized that this was something that employers could use to help lower their healthcare costs for their employees, and then as a health insurance adjacent app, we've realized it's kind of an app for everyone from say 10 or 12 to early 80s. Anybody who's comfortable using a smartphone, this would be an applicable application for, not to be redundant. And there's a wide variety of applications for it, but the main ones that we think of are, the healthcare system is extremely fragmented. You have your electronic health record systems, which contain your medical records for that provider. And if you're lucky, you have providers who are on the same EHR system, but then if they're not, then you've got to go through the entire hassle of getting those medical records from your other provider who's not on that system. And I'm a very technical person, and I can tell you it is a pain in the neck for me to get the letter written and signed and faxed and sent to get those medical records. I can't imagine what it is like for other people. And so we have these safety systems that are here, and we have electronic health record systems that are here, and then we have home health care and caregiving systems, and none of them are integrated. None of them really talk to one another. And from my own experience, I know how much hassle it is to get information from one to another. And just the simple thing of a patient intake form, which probably everybody has filled out at least 20 times in their life. And every time I have to fill this thing out, I look at it and think, why can't we standardize this? This is the same information. So we did. We standardized it and made it so that everybody can keep all of their medical information in the app, all of their symptoms, all of their allergies, their medications, everything can be in the app. And we've made it so that we can integrate that with electronic health record systems, and share it with first responders and emergency contacts, so that it makes diagnoses faster. It makes the system more efficient. It saves money. And it vastly improves outcomes and the patient experience.
That's a key. You said maybe not the most important thing, but you said an important thing there towards the end, didn't you, about the patient experience?
And it lowers a lot of costs too, because I mean, let's think about it. If you slip in the shower and somebody finds you within an hour or two, you go to the hospital and it's one set of issues. You slip in the shower and hit your head and you lay there for 3 days and somebody finds you. And I've actually talked to 2 different people in the past 6 months that have had coworkers or family members that this happened to. They slipped in the shower, hit their head, laid there for 3 days, and they were found. The one person's parent died. The other person died at the age of 36 from this. They had terrible outcomes and very expensive once you get to the hospital. So if we can reduce that response time to an emergency and or eliminate visits to the emergency room or reduce those, we can save a ton of money in the healthcare system and frankly eventually be able to afford healthcare for everyone.
Well, there's a thought. We'll come back to that when we talk about your vision for the future. This is exciting. And with your technical background, my assumption is, and we don't need to get into the details of it, but you must have been able to overcome some restrictions on this type of information, the HIPAA laws, etc. So you must have been able to figure out and get this so that it's compliant, so that people can use this information and it's all good for them, right?
HIPAA is yes, absolutely. HIPAA is a self-certification process. And so we consulted with our chief medical officer and said, okay, so what do we need to do? We found an online HIPAA training. And I said, okay, everybody on the team has got to go take this training. And you got to go get your little certificate so that we can say everybody's taken this. And then the platform on which we have this built is like HIPAA compliant in and of itself. So we've kind of inherited some of the compliance from that platform. Now, all that being said, there is a certification which we really want to get. It's called HITRUST, HITRUST.
Yes.
And it's kind of become the gold standard, if you will. And virtually every state will accept it. Let's see, the Mayo Clinic accepts it. I think the Anderson Cancer Center accepts it. This is like big stuff. And there is absolutely only one thing standing in the way of us getting that certification, and it's money, because I need about $35,000 to just start on it and another 15 or so to finish it. So if there's any investors out there who want to help me get this and deploy this awesome app everywhere, call me.
Right. Yeah, I'm familiar with the rigors of HITRUST and what it means to companies that are able to not only get it and then maintain it, because like any certification, you're going to be audited and you've got to be sure.
Yeah, it's something I think there's 3 different levels, and I think I hope I don't have this backwards. At the lower 2 levels, you have to recertify every year, and at the highest level, you have to recertify every 2 years. But again, with the platform that we have our app on and the database on, we can inherit some of that certification requirements from that, but we still have some that we have to do ourselves. And
Sure.
cybersecurity is not, of all of the technical things that I know about, cybersecurity is not really one of them. So this is, an area where I've found cybersecurity people, and I'm like, okay, as soon as I get this money, I'm going to give it to you and say, you deal with this problem, okay?
Yeah, great. All right, let's turn your focus a little bit here for the time left on the show, Sandy. I'm wondering if you can think back to a piece of business advice you've picked up along the way that you found valuable, that you kind of used to inform your career and maybe your current position as CEO and founder.
Absolutely. I never read this book, but I've heard of it. I heard of it many years ago when I was doing a summer internship, in between semesters at college. And the name of the book was Do What You Love and the Money Will Follow. And that has really been my philosophy. This wasn't advice that anybody gave me, but it has been my philosophy. And I can tell you that, and if any of my friends are listening to me, they will know exactly which job I'm referring to. But I had this job in Irvine many years ago, and I hated that job. I just hated that job. And I was paid well, and it was a good place to work and all that, but I hated that job. It was just so dull. On the other hand, I've been working on this for a couple of years, and I can't wait to get out of bed in the morning and work on it. And, I haven't drawn a salary. I'm a founder. I'm fundraising. I haven't drawn a salary for this. And yet I will happily stay up till 5 o'clock in the morning and work on the database or work on a press release or do my marketing and all that stuff. So doing what you love makes all the difference in your motivation in doing this.
I love that. Yes, that's, I've been asking this question for 3+ years now, and I always am fascinated by the answers, and I appreciate you sharing it with my audience. Let's point you in the direction of artificial intelligence, Sandy, and talk to us about your global view of AI as an innovation, maybe how you see it impacting your industry and your firm, and where you're leveraging it today inside the app and inside your company.
Well, having been in tech for as long as I have, they first started talking about AI around 38 years ago is what I can remember. And so when it hit big 3 years ago with the release of ChatGPT, I kind of just stood there and laughed because everybody was like, oh, it's this new invention. I'm like, no, it's really not a new invention. Ask me how long I've been hearing about this. I think it's phenomenal. I from a deployment standpoint, I can sit here and tell you that the marketing and the sales and the website and the, so many things that I do as a founder, I would have had to hire at least 5 or 10 people or a marketing agency or some combination thereof and spend a lot of money to do the things that I've been able to do with various AI tools. And I subscribe to ChatGPT and Canva and a few others. And I've become a big fan of dictation on my laptop because you might notice I talk a little bit faster than I type. And so I just dictate and say, okay, so this is what I'm thinking. And at this point, I've got it kind of trained on what my business is. I just tell it what I want and it spits stuff out. And it gets probably 70% of the way there. And then, I use my own background to kind of refine this. Now, all that being said, I've had a career for a long time. Do I think people who have not already established themselves in a career should be using AI tools to the extent that I do? And the answer is probably not. You need to learn to write on your own. You need to learn to cross-check your references. You need to learn to do citations. You need to learn to write in a technical fashion. and to present your ideas competently, because there are a lot of things. I was writing a press release last night, and just the way that ChatGPT wrote it, I was like, yeah, this needs to be bussed up. It can be a little long-winded in places. And so you need to be able to do that part of it yourself. As far as implementation in our app, we are planning to do, and it's not released yet, but we have all the components there for it. We're planning to do, what are we calling it? Personal health risk analysis, as well as like a digital triage where people can, feed information into the app and say, do you think I'm okay, or do I need to go to the emergency room? Now, at no point are we going to be giving medical advice, because that gets in trouble with a whole lot of HIPAA laws and everything else.
Sure.
But this is kind of going to be okay, based on your family history and what you've put into the app and the questions that we've asked you, we think that you're going to be okay, but you should always consult a medical professional, because we are none of those. Even though we have a doctor on our team, she's not licensed in every state, and, we can't be giving medical advice.
Interesting. Okay, so we've got a little bit of time left, and I didn't want to leave the interview without you kind of sharing your vision for the future. Sandy, talk to us about where you see this app going. You sort of touched on some ideas you have for products not yet released, but just a global vision for your application.
The global vision, well, I'll start with the U.S. vision, which is for it to be adopted by Medicaid and Medicare and Medi-Cal here in California and the VA system, because the integration of the ability to have earlier detection of illnesses and emergencies, that alone will save a lot of money. And then being able to take the information in the app and just immediately share it, comprehensive information. I mean, everybody goes to the doctor. I have an excellent memory, and I go to the doctor and they ask me what my medications are. And, 10 minutes later, I'm like, oh my God, I forgot that I take blah, blah, blah too. Okay. So clinicians need all of that information. So if you've got this app and you remember a half hour after you left your appointment that you also take this other medication, you could just put that into the app and then share it. So from a national standpoint, I want this adopted basically by everybody to help lower healthcare costs and to make our healthcare system more efficient. You probably are aware that we have a shortage of healthcare workers right now. Globally, I'm planning to translate the app into at least the top 20 languages worldwide, which would cover 75% of the world's population. I've already spoken with people in the UK and Australia who have talked to me about, their national health system and the gaps in it and how beneficial this app would be there. And I'm like, I only need one thing to get this going, and that's money. Got all the ideas. I got the database built. I got the developer. I just need the money. So that's really the global vision, is to push this out everywhere to make healthcare accessible for all, including rural health applications, which have really taken a hit in recent years as far as availability, but to make it accessible and affordable to all, and to improve the efficiency of the system and improve longevity, and make the whole healthcare experience and safety experience substantially less exasperating.
Well, entrepreneurs are problem solvers, and you found some problems that need solving, and you are building a solution for that, which I applaud you for. If someone would like to learn more, maybe connect with you, Sandy, learn more about Life Backup Plan, where do they go? How do they do that?
My email is founder@lifebackupplan.com. The website is www.lifebackupplan.com. And my phone number is 858-848-0860. And if you Google my name, I guarantee you I am the only one out there. There is one other Sandy Eulitt, but it's her married name, and she lives in El Cajon, and she has a different middle initial. So some of our information gets mixed up, but 99% of it is me.
Well, I said at the top of the show, ladies and gentlemen, we had a good one planned because we have a CEO and a founder in Sandy. I say you did not disappoint. I want to thank you for your time today.
Well, thank you, Rick. It was fantastic being here. I've really enjoyed talking with you.
And I want to thank the audience. You're also a part of Orange County's longest running business talk show and podcast. Sandy's episode is going to join our catalog of over 1,600 shows that we've done over the years. If you happen to be in Southern California, an entrepreneur, and you'd like to share your story, business owner, then reach out to me and I'll be happy to work with you. And our producer, Maylene, will get you ready so you could be a future guest on Critical Mass Business Talk Show. And until the next time, we all have a chance to be together. I hope that each of your business decisions will move your companies in a positive direction.